Children's Dimetapp is used for the temporary treatment of cough, stuffy nose, and sinus pain pressure caused by infections such as the common cold, flu, or other breathing illnesses such as hay fever, bronchitis. This product contains a decongestant such as pseudoephedrine, phenylephrine that works by nerving the blood vessels to help relieve stuffy nose symptoms and sinus pressure. This product also contains a non-opiate cough suppressor. Indications: temporarily relieves cough due to a minor throat and bronchial irritation occurring with a cold and nasal congestion due to the common cold, hay fever, or other upper respiratory allergies. Temporarily relieves these symptoms due to hay fever, allergic rhinitis, runny nose, sneezing, itchy, watery eyes, itching of the nose or throat. Temporarily restores free air breathing through the nose. How to use: don't take more than 6 doses in any 24-hour period. Measure only with dosage cup provided. Keep dosage cup with product. Dosage: adults and children 12 years and over, 20 ml every 4 hours. Children 6 to under 12 years, 10 ml every 4 hours. Children under 6 years don't use. Contraindications: don't use Dimetapp if you have taken an monoamine oxidase inhibitor in the past 14 days. A dangerous drug interaction could occur. Monoamine oxidase inhibitors include isocarboxylate, linezolid, phenelzine, ersegaline, selegiline, and tranylsapramine. You should not use Dimetapp cold and allergy if you are allergic to brompheniramine or phenylephrine. Ask a doctor pharmacist if it is safe for you to take Dimetapp cold and allergy if you have asthma or COPD, cough with mucus, or cough caused by smoke and emphysema or chronic bronchitis. A blockage in your stomach or intestines, kidney or liver disease, high blood pressure, heart disease, coronary artery disease, or recent heart attack, enlarged prostate or urination problems, glaucoma, diabetes, epilepsy or other stage disorder, pheochromocytoma, an adrenal gland tumor, overactive thyroid, or if you take potassium. Warnings: don't give Dimetapp cold and allergy to a child younger than 4 years old. Always ask a doctor before giving a cough or cold medicine to a child. Death can occur from the misuse of cough and cold medicines in very young children. Dimetapp cold and allergy may impair your thinking or actions. Be careful if you dry or do anything that requires you to be alert. Drinking alcohol can increase certain side effects of Dimetapp cold and allergy. Ask a doctor or pharmacist before using any other cold, allergy, or sleep medicine. Brompheniramine and phenylephrine are contained in many combination medicines. Dimetapp side effects: get emergency medical help if you have any of the signs of an allergic reaction to Dimetapp, hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Stop using Dimetapp cold and allergy and call a doctor at once if you have chest pain, rapid pulse, fast or uneven heart rate, confusion, hallucinations, severe nervousness, tremor, seizure, convulsions, little or no urinating, easy breathing or bleeding, unusual weakness or dangerously high blood pressure, severe headache, buzzing in your ears, anxiety, shortness of breath. Common Dimetapp side effects may include dizziness, drowsiness, blurred vision, dry nose or mouth, nausea, stomach pain, constipation, loss of appetite, problems with memory or concentration, feeling restless or excited, especially in children.